Welcome back, everyone, for another deep dive. Today we're going to be talking about Medicaid. And, it's one of those things that a lot of people have really strong opinions about. And you might think, oh, well, it's, only affects a certain population. But as we're going to discover in this deep dive, that is definitely not the case. So we've got a stack of sources for this one. We've got some opinion pieces. We've got some personal accounts from a focus group that was done by the Kaiser Family Foundation, and then some hard data as well. So, trying to get to the bottom of this and figure out, what would cuts actually look like and who stands to be the most affected? And what are people who actually rely on Medicaid saying about all of this?
Yeah, that's a great place to start. It's important, I think, to remember that Medicaid covers a huge swath of the U.S. population. 1 in 5 Americans are covered by Medicaid, and that includes almost 60% of children. And it's also a major funding source for nursing homes and rural hospitals.
Wow, so it's a pretty big deal then. But why are we even talking about cuts to something that seems so essential?
Well, the proposed Medicaid cuts are tied to this broader push by Republicans for some pretty significant tax cuts. And that's creating some tension here. So the House Budget Resolution is targeting like $880 billion or more in potential reductions to federal Medicaid spending. But meanwhile, like a large majority of the public, 77%, view Medicaid favorably. And almost half of those surveyed think that the government isn't spending enough on it.
It does seem like a bit of a contradiction there. Cutting a popular program to fund tax cuts that, as you said, might not even benefit most people. So what's the logic there?
Yeah, that's the million-dollar question, right? I mean, it's a complex situation for sure where political agendas and public perception really clash. And the potential impact on individuals and families who rely on Medicaid just can't be overlooked.
Okay, so let's unpack some of those impacts then. You mentioned this Kaiser Family Foundation study. What did they learn when they spoke to both Trump and Harris voters about their experiences with Medicaid?
Well, one of the most striking findings was how much people's experiences transcended their political lines. So both groups of voters expressed a really deep appreciation for their Medicaid coverage. They were afraid of losing access to, vital services and expressed concerns about the potential financial burden if those cuts did go through. So it really highlighted how much healthcare needs kind of go beyond political affiliations.
Yeah, it seems like one of those things everyone can agree on, good health care and not going bankrupt because of it. But beyond the numbers, I'm curious what these individuals had to say. Like, what were some of their stories? What did Medicaid mean to them?
Well, people shared some very, very personal and powerful experiences. So one participant, for example, talked about how Medicaid was really essential for them to manage their mental health challenges. Imagine someone who's struggling with anxiety or depression, suddenly losing access to therapy or medication. The ripple effects on their work and their relationships and their daily life could be really huge.
Yeah, that makes sense. Taking away that support system could be devastating for someone who's already dealing with mental health issues. Were there other stories that stood out to you?
Yeah, a lot of people talked about how Medicaid enabled them to manage chronic conditions like diabetes or cystic fibrosis. And these are often lifelong conditions, right, that require ongoing care and medication. And those things can become incredibly expensive without adequate coverage.
So it's not just about treating immediate problems. It's really about providing that ongoing support that people need to actually live their lives. And taking that away could have those far-reaching consequences.
Exactly. And what really struck me was the emphasis on financial protection and peace of mind that Medicaid offers. So, one individual with diabetes talked about how before Medicaid, they had to ration their insulin because they couldn't afford the full dosage. And that kind of choice really puts people in an impossible situation where they're forced to risk their health because of financial constraints.
That's heartbreaking. It sounds like Medicaid really helps people avoid those impossible choices and, manage their conditions without the added stress of potentially going bankrupt. Did the study participants share any thoughts about the proposed work requirements, this idea that recipients would have to work to qualify for coverage?
Yeah, that was a key focus of the study, for sure. And there was a range of reactions. Some people who are currently working felt confident about meeting those requirements. They weren't necessarily opposed to the concept, but they were concerned about the added bureaucratic burden of having to prove their employment. But others, especially those with disabilities or caregiving responsibilities, expressed some serious doubts about their ability to actually meet those requirements.
It makes you wonder, is adding more paperwork and hurdles really helping people get back on their feet?
It's a great question. The study highlighted a point that's often overlooked in these discussions. Access to consistent treatment is often what enables people to work in the first place. So taking away that access could actually create this catch-22 where individuals lose the very support that's helping them maintain employment.
And it's not just about individual impact, right? I mean, we have this article here that argues that even without direct cuts to senior care, the future of Medicaid looks pretty grim. Why is that?
Well, this article really focuses on the domino effect of what might seem like indirect cuts.
Hmm.
So let's take nursing homes as an example. If the government trims reimbursement rates to those facilities even slightly, it can force them to cut staff or even close down altogether.
So something that wouldn't even get a lot of attention could actually have a huge impact on seniors needing care.
Exactly. The article uses this analogy of musical chairs. So as facilities struggle and close, patients are forced to move, and it creates a shortage of beds, making it even harder for those needing care to find a place.
We've talked a lot about, the effect on patients, but what about the people who work in these facilities?
That's a crucial point. Nursing homes are often major employers in rural communities. So closures and job losses could have this ripple effect on those local economies, impacting families and businesses beyond just the healthcare sector. And there's another layer to this whole problem, too. Remember those estate attorneys we talked about earlier? They describe this Medicaid application process that's just incredibly cumbersome, and it relies on this outdated technology like fax machines. Like imagine waiting over 100 days to get approved for essential healthcare.
Over 100 days. That's insane. I can't imagine the stress of waiting that long while you're also dealing with a health crisis. What happens if someone needs care immediately?
Yeah, that's a huge concern. Those lengthy approval times really create these significant barriers to timely care. And it gets even worse when you factor in potential budget cuts. Well, if Medicaid agencies face staffing reductions because of budget cuts, those approval times could actually become even longer. So it's like this perfect storm of bureaucracy and budgetary constraints that leaves individuals and families caught in the middle.
It seems like a lot of the debate around Medicaid focuses on cutting costs and finding efficiencies. But a lot of times, those efficiencies come at the expense of the very people that the program is supposed to help.
Yeah, that's a crucial point. The focus group study really brought to light how much of the political rhetoric around Medicaid seems really disconnected from the lived reality of the people who rely on it.
What do you mean?
Well, some of the Trump voters in the study were actually surprised and even disbelieving when this topic of potential cuts came up. They voted for a president who promised to protect Medicaid, and now they're facing this very real possibility of losing the program that they depend on.
That's got to feel like a betrayal.
Yeah, it certainly highlights the gap between political promises and the actual impact of policy decisions. It also underscores the need for voters to hold their elected officials accountable for their actions, especially when it comes to programs like Medicaid.
We've talked a lot about, the human costs of these potential cuts, but I'm also curious about the broader economic implications. What happens if people lose access to the health care they need to, stay healthy and productive?
Right. Medicaid isn't just a healthcare issue. It's an economic issue, too. If people can't access care, they might not be able to work, which leads to lost productivity and potentially a strain on other social safety net programs.
So it's like one problem creates this chain reaction of other problems.
Precisely. And we can't forget about the impact on the healthcare industry itself. Remember how we said that Medicaid is a major funding source for healthcare providers, especially those in rural areas?
Yeah, you mentioned that earlier. What would happen to those hospitals and clinics if that funding was cut?
Well, many rural hospitals already operate on these really thin margins. They depend on Medicaid reimbursements to keep their doors open. So cutting Medicaid could lead to hospital closures, job losses, and a decline in the overall economic health of those communities.
And then that has a domino effect on access to care, too. So if hospitals close, people have to travel further for treatment. They might face longer wait times and higher costs.
Exactly. It becomes this vicious cycle. And it's often the most vulnerable populations, the ones in rural areas or low-income communities or with chronic health conditions, that bear the brunt of these negative consequences.
It seems like we're at this crossroads. We need to decide what kind of society we want to live in. Are we going to prioritize tax cuts for the wealthy at the expense of essential programs like Medicaid?
That's the question at the heart of this whole debate. It's about values and priorities and our collective responsibility to ensure that everyone has access to quality health care.
This has been a sobering look at the complexities of Medicaid and, the potential fallout from the proposed cuts. It's clear this isn't just a political issue. It affects real people in these really profound ways.
Yeah, and while the challenges are definitely significant, it's important to remember that this isn't a hopeless situation. There are alternative solutions and potential paths forward that could actually strengthen Medicaid and improve the lives of those who depend on it.
Okay, so we've covered a lot of ground here talking about these potential cuts to Medicaid and the impact that could have. And it's easy to get bogged down in, all the challenges. But like you said, it's not a hopeless situation. So let's shift gears a little bit and talk about some of those potential solutions or alternatives that are being discussed. What are some ways that we could actually improve Medicaid rather than dismantle it?
Yeah, that's the key question, isn't it? And I think what I find really encouraging is that even in the midst of this, really contentious debate, the focus group study revealed some common ground. So both Trump and Harris voters expressed this desire to see Medicaid not just preserved, but actually improved.
So it wasn't just about what they stood to lose, they were also thinking about how to make things better. What were some of the suggestions that came up?
Well, one of the most frequent suggestions was expanding dental benefits. A lot of people pointed out that dental care is often overlooked, but it's absolutely crucial for overall health and well-being.
Yeah, it's hard to feel confident and healthy if you're struggling with, dental problems. It makes sense that people would want to see that included.
Absolutely. And there's also this growing recognition that, oral health is linked to other health conditions. Neglecting dental care can lead to more serious problems down the road. And ultimately, it ends up increasing healthcare costs.
Were there any other areas that people felt strongly about?
Yeah. Another common concern was the lack of doctor availability, especially in these underserved areas. People talked about having to travel long distances or wait months for appointments, which really highlights this need for more providers and better distribution of resources.
It seems like that kind of ties into another issue that came up, the frustration with the prior authorization process. Can you explain what that is and why it causes so much trouble?
Yeah, prior authorization is basically a process where your doctor has to get approval from the insurance company before they can prescribe certain medications or treatments. And the focus group participants just found this process to be incredibly burdensome and often really confusing. They complained about delays in getting approval, which sometimes meant that, they couldn't access the care they needed when they needed it.
So it's like another layer of bureaucracy that's added on top of, the stress and uncertainty of dealing with a health issue.
Exactly. Streamlining that process and making it more transparent could really go a long way in improving people's experiences with Medicaid.
It seems like a lot of these suggestions are just common sense improvements that could make a real difference in people's lives.
That's what I found so encouraging about the focus group findings. Despite this political divide, there was this shared understanding that Medicaid is a valuable program that deserves to be strengthened, not dismantled.
So where do we go from here? What can our listeners do to make sure their voices are heard and, contribute to a better future for Medicaid?
Well, as we've seen throughout this whole deep dive, knowledge is power. Understanding the complexities of Medicaid, the potential impact of these cuts, the diverse perspectives of those who rely on it. That awareness is the first step.
Okay, so we've got to educate ourselves. But then how do we turn that knowledge into action?
There are so many ways to get involved. You can contact your elected officials, let them know how you feel about the proposed changes to Medicaid. You can support advocacy groups that are fighting to protect and improve the program.
It sounds like there's a lot we can do even on an individual level.
Absolutely. Every phone call, every email, every conversation can make a difference. And don't underestimate the power of sharing your knowledge with others. By talking to your friends, your family, your community members about Medicaid, you can help raise awareness and inspire others to take action.
It's about turning our concern into these constructive efforts to protect and improve this vital program.
Exactly. Remember, Medicaid is about people. It's about ensuring that everyone, regardless of their income or background, has access to the health care they need to live healthy, productive lives.
This deep dive has been eye-opening and honestly pretty inspiring. It's given me hope that we can work together to create a more just and equitable healthcare system for all Americans.
I share that hope. And by engaging in these informed discussions, advocating for positive change, holding our elected officials accountable, we can ensure that Medicaid continues to serve as this lifeline for millions of people for generations to come.
Thanks for joining us on this journey. Until next time, keep diving deep.